Knock, knock. Hi guys, I'm Dr. Abby Waldman from Brigham and Women's Hospital in Boston, and today I have the ultimate skincare routine for your teens. So whether you were a teenager yourself or you were the parent of a teenager hoping to hone in on a great skincare routine, this is for you. Now, skincare in your teens actually can be very basic, but there's so much out there on social media about skincare. It is really difficult to figure out as a teenager what you should be using compared to, say, somebody who is my age. And most of the things that are advertised for people my age actually either don't help you at all, or they might even cause harm because they're pretty harsh ingredients. So we'll go over just a basic routine if you have no skin problems. We'll also go over a basic acne routine because acne and acne scarring is very common in your teenage years, as well as body acne, folliculitis, breakouts on your body. So we'll talk about what to use, as well as body odor, because those are things that start to happen when you're a teenager as your hormones change and you start to get older. So let's get to it. So first off is cleansing, washing your face. So what do you need to wash your face? Essentially everything up until your teenage years, usually water was sufficient, right? You're in the shower, you just wash your face with water, and that's really all you need. As you become a teenager though, your hormones change and actually activate sebum production, so then you're gonna get more seborrheic dermatitis, little rashes around your nose, around your eyebrows, and all that dirt and dead skin kind of blocks the pores and causes acne. So this is around the time that you may consider adding something besides water to wash your face. It's also the time where we start to play around with makeup, right? So instead of putting nothing on your face, in which case you have not much to wash off, you now have different things that you're putting on your skin that you do need to wash off at the end of the day. You can think of face washing actually just like brushing your teeth, right? We have different bacteria in our mouth and they grow during the night. They feed off of sugar during the day that you're eating, and you need to just brush them off twice a day. Because if those bacteria and fungi and parasites grow too much, they're gonna take over. You're gonna get all sorts of skin problems down the line. So in terms of cleanser, first you have to ask yourself, do I even need a cleanser? If your skin is very dry and you don't have a lot of skin issues aside from dryness, you may still consider just doing water twice a day. Again, if you wear makeup, we'll talk about that separately. If your skin tends to be oily or acne prone, or you're wearing makeup, you wanna pick a gentle cleanser. I've shown some of them here. My favorites are the La Roche-Posay Gentle Cleanser. Even things as basic as Dove Sensitive Skin Body Bar, you can actually use to wash your face and your body. They're very gentle and you can use them once or twice a day. If you have a lot of acne, you're going to use a cleanser like panoxyl, benzoyl peroxide, or salicylic acid, which turn over the skin a little bit and keep bacteria from growing and causing acne. These can be quite drying though. Again, they're meant to reduce oils, and so you may find they're more drying than, say, a gentle cleanser. If you're using makeup, it goes without saying that you need to remove your makeup, right? The makeup stays there, it blocks the pores. You can get more sensitivities to actually ingredients in the makeup if you're leaving it on all the time. And that's not to say we haven't all slipped in our makeup sometimes, but it's really not something you want to do on a regular basis. You may have heard about double cleansing. Double cleansing is basically removing the makeup first and then just cleansing with a regular cleanser. So there are two ways to remove the makeup first. One is with a micellar water. This is the one I like from Bioderma. You put it on a cotton pad, you hold it on your makeup, you remove the makeup, and then you wash it all off. Recently, I've been more into using an oil-based cleanser. You're gonna put a little bit of oil on dry skin, remove all the makeup, wash it off with water, take a little washcloth, remove the makeup, or take a little cotton pad, remove the makeup, and then again, washing with your regular basic cleanser. That is double cleansing in a nutshell. So what about your body in terms of cleansing? This is again a time where your hormones are changing. You may have more body odor. You may have more body odor breakouts. You may be going to the gym, doing sports, having occlusive clothing afterwards. You go, you work out, and then you hang out in your sweaty shirt, and that's gonna cause some folliculitis and breakouts. So generally an antimicrobial, antibacterial soap is sufficient for many people in terms of cleaning their underarms, the folds of the skin, the groin, the buttocks, and that often will do the trick. If you're doing that regularly and you're still having significant body odor or breakouts, you may consider washing with these three things. The first is HipaCleanse. HipaCleanse is an antimicrobial that we use as physicians to scrub in, to wash before procedures. It has pretty broad spectrum. It kind of wipes out any bacteria. It can be toxic to the eyes and ears, so you don't really want to use it everywhere, but it's really good for those areas that tend to carry a lot of bacteria, underarms, even the back, if you're getting breakouts there, or the chest, groin, buttocks. Can be used for scalp folliculitis, different types of breakouts and boils that you're getting. This is great. Again, do not get it in your eyes or your ears because it's very strong. Another option is benzoyl peroxide. I mentioned that earlier as a way to wash your face for acne, but it can also work on the body. It's a great way to kill bacteria, kill microbes on the body for the underarms, body. And the last is actually dandruff shampoo. Dandruff shampoo like Head & Shoulders or Nizoral are antifungal in nature. They generally tend to work for fungus on the scalp to reduce dandruff, but they can also be used if you get little scaly, greasy breakouts on your face, if you're getting a lot of like tinea or fungal breakouts on your body. Head & Shoulders, Nizoral can really work well actually as a body wash or a face wash. Again, tend to be very drying in nature, but can get rid of some of those like common issues. Again, if you're an athlete, if you are wearing sweaty clothing a lot, these tend to be really common problems that everyone runs into. And it can reduce body odor as well. Again, because it has that microbial effect. Oftentimes body odor is due to certain bacteria overgrowth, like again, under the arms, in the groin, buttocks. And so that even with really good hygiene, you still can have sweating and body odor. And so again, Head & Shoulders, as well as the HIPAA cleanse and the benzoyl peroxide can all help with those issues. And the last tip I'll give for body odor and sweating is actually using something that's traditionally designed for the face. Again, a glycolic acid or lactic acid wash or toner. And so why would glycolic acid toner work for under the arms and for decreasing body odor and sweating? It actually changes the pH and it lowers the pH to make it more acidic, making it less likely for fungus and bacteria to throw a party under your arms. And so just using this a few times a week, Dove actually has a product that just has lactic acid in it, which does the same thing. It's called Whole Body Deo. Same concept. It has lactic acid. You can put it anywhere and it will control the amount of fungus and bacteria that are growing on your skin. So something to consider if that is a problem for you. Okay. Moving on to moisturizing. So now we have washed everywhere, right? And unlike the days where you can kind of get away with just washing your face with water and maybe not moisturizing afterwards, if you are using a cleanser of some sort, even a gentle cleanser, basically, in addition to stripping some of the makeup off and the bacteria off and the dirt, you're also getting a little bit of your skin barrier off. And so the moisturizer just adds that back in and it kind of locks the moisture in so you don't get dry skin, you don't get rashes and irritation from dry skin. So moisturizers, again, can be really simple. You don't have to spend a whole lot of money on a moisturizer. You basically have two choices. You can get a moisturizer without sunscreen, or you can just get a moisturizer with sunscreen. Benefit of moisturizer without sunscreen, you can use it in the morning, you can use it at night, but then if you're going out in the sun, you need to additionally apply a sunscreen separately. If you get one with sunscreen, it's great. You wash your face, you put on one product, you're done, you're out the door. But it means you need to get a separate one for at night because you didn't really need to be putting sunscreen on your face at night, right? So here are a few that I really like. I'll include them in the link below in the description. So this is BU Hyaluronic Acid Gel Moisturizer. It's a very light moisturizer if you tend to be on the oily side. Triple Repair Moisturizing Cream is great if you tend to be on the dry side. You can actually use this on your face and your body. Other ones for really dry skin are the Cicaplast Balm La Roche-Posay. You can tell I really like La Roche-Posay products if you have really dry skin. They make some really incredible moisturizers that are also quite clean. And then the last two for drier skin that I like are the Inky List Bioactivating Ceramide. I also love the Ordinary Natural Moisturizing Factors. I don't have it because I finished it. It's great. For very oily skin, I like Banish Vitamin C Cream. It's a very light moisturizer. It has vitamin C, which can actually help with some post-acne scars or pigment. Very light, great. Another one I really like is the Hyaluronic Acid Gel Moisturizer by BU. That is a very lightweight gel moisturizer if you are oily or very acne prone. In terms of moisturizers with sunscreen, my two favorites are Rock Multi-Correction Revive Glow Moisturizer. It has, again, that vitamin C serum. It has an SPF of 30 and a great moisturizer. Again, this is really only a morning moisturizer because you can't really wear it at night. It does have sunscreen. I mean, you could wear it, but you don't need sunscreen at night. The other one I like a lot and have used a lot in the past is Aveeno Positively Radiant. It does have some soy in it that can help with brown spots and again, that sort of those acne post-inflammatory scars that you can get. CeraVe AM is another one that I've liked and used in the past. And of course, you can keep it even more simple and just get simple petroleum jelly, Vaseline, Aquaphor. It's great for night. It's a little greasy. Some people don't like that, but that's certainly a great option too. Now, if you don't have sunscreen in your moisturizer, unless you are like literally inside all day, not even going close to a window, I do advise that you wear sunscreen. The earlier you start, the better. It's really going to help down the line. It's going to help protect your skin from skin cancer. Choosing a sunscreen is a whole video in itself. You can check out my video here about how to choose a sunscreen. I personally like tinted mineral sunscreens. They're very good for rosacea. They're good if you want to avoid any sort of chemical sunscreen. They do tend to run a little more pricey. My two favorites are Sente and La Roche-Posay tinted mineral. But again, if you're very concerned about chemicals in your sunscreen or any sort of potential issues with sunscreen, picking a mineral sunscreen, either zinc oxide or titanium dioxide or both, is your best bet. Safe, done. Now, the reason for adding the tint to it is that they can cause that white look that you see sunscreen have. So that's why the tinted part of it really reduces that. They can be harder to blend in if you're skin of color. Again, just because the tint can help, but it still has underlying very white look to it. Sunscreens that tend to blend better are chemical sunscreens. My favorite right now for teenagers, if you have acne and acne spots, hyperpigmentation after acne, is the La Roche-Posay Mela B3 UV. It has niacinamide in it that can help with acne as well as brown spots. It can also help with melasma if you have melasma. Elta MD has also a sunscreen with niacinamide that is really great for acne, for teenagers, for post-inflammatory marks. My favorite, if you have skin on the drier side, not acne prone, is La Roche-Posay Anti-Helios UV Hydra. Again, these are chemical sunscreens, so just keep that in mind. And that is pretty much it. That is really the basics of what you need in your teenage years. You do not need vitamin C serum. You don't need an extra hyaluronic acid serum. Your skin has all those. It hasn't started losing them like my skin has. You don't need to go get an anti-aging retinol when you're in your teenage years. It's not going to help. It's only going to cause problems. Now, I mentioned, the glycolic acid toner, you can use that. It's certainly okay to use that on your face, but just be really, really careful with it because it basically strips the outer layer of your skin. So if you do it too frequently, if you're doing it every day and you start noticing rashes and breakouts, think about any toner you're using first. So I do not suggest going out and getting a toner for your face if in your teenage years, but if you already using one, if you saw it online, if your friends are using them, you want to use what everyone's using, again, be really careful. Look on your ingredients, see if it says lactic acid, glycolic acid, salicylic acid, AHA, BHA. Those are all key words that it isn't a chemical exfoliant. So it's removing the outer layers of your skin, which is as you get older, you may need some help exfoliating your skin. Your skin is exfoliating itself just fine right now. You do not need any help. So again, I advise sticking to the basics, just washing, moisturizer, sunscreen. Anything extra in your skincare routine should be really focused on the exact problem that you have. So if you have acne, in addition to using benzoyl peroxide or salicylic acid as a face wash, you may consider using adapalene at night. That is a retinoid that is over the counter in the US, and it is focused on acne. Use a pea-sized amount all over, and you're gonna cover that with a moisturizer. Generally, you start every 3 days initially, and then build up to every night as you can tolerate. Again, it's very irritating, but it can be very helpful if you have acne. The next step after adapalene would be a prescription medication for acne, and that would include topical antibiotics, oral antibiotics, topical prescription retinoids like tretinoin, Accutane. Any of these things would be sort of after any over-the-counter acne medicine has not worked. And generally give it a few months if you're just starting out, because it can take a while to see results. But us dermatologists can be helpful in helping your acne when these great other options aren't doing the trick. The other treatment to consider for your acne over the counter, if you don't like the idea of using benzoyl peroxide as a face wash, you can use it as a spot treatment or even as an all-over treatment. Two of the most popular ones are La Roche-Posay Effaclar Duo and Neutrogena Rapid Clear Stubborn Acne Spot Treatment. So let me know in the comments what questions you have about skincare in your teens. Like this video and follow me if you want more skincare and dermatology information videos like this. I'm Dr. Abby Waldman. Be well.